Welcome to Voices of Empowered Parents, the podcast where families, educators, advocates, and professionals come together to support children and empower the parents who walk beside them every day. I am your host, Dr. Julie M. Lane, founder of the Empowering Parents Network. Today's conversation is one that many parents will relate to because it begins with something that is often difficult to navigate. Knowing something isn't quite right with your child while struggling to find someone who will listen. Every parent wants to believe their concerns will be heard and taken seriously. Unfortunately, many families encounter moments when they feel dismissed, uncertain, or left searching for answers on their own. Those experiences can be overwhelming, but they can also become the catalyst for powerful advocacy. Joining us today is Corrinne Mercer, a board-certified behavior analyst, founder of Amaryllis Behavioral Health, and a mother of 2 children, including a son with dysphagia and motor and speech delays. Corinne's personal experience as a parent has shaped her professional mission to helping families access meaningful behavioral support throughout every stage of life. She is especially passionate about helping families understand that applied behavior analysis services are not limited to young children. Adolescents and adults can continue receiving behavioral support through private insurance and Medicaid waiver programs, opening doors to greater independence, social connection, and quality of life. Today, we'll discuss trusting your instincts as a parent, advocating with medical and educational systems, and understanding the meaningful support can continue well beyond childhood. Corrinne, welcome to Voices of Empowered Parents.
Well, thank you for having me. I'm really excited to be here.
Absolutely. Can you share your family's journey and how your experiences as a mother inspired you to become a board-certified behavior analyst and establish Amaryllis Behavioral Health?
Yeah, so I was actually a BCBA before I had kids, but I was working with, the typical pediatric population. So early intervention, all the way up to 18 years of age. And when I had my daughter, I started to realize that I was getting to a point where I was pouring everything into the kids that I worked with and their families, which is great, and they absolutely deserved it. But it was leaving me nothing in the tank when I'd get home from work at the end of the day. So I made the career switch to start working with adults when my daughter was about 9 months old. And it was absolutely a eye-opening and huge jump to the science of behavior analysis. It is applicable across the lifespan. They have dementia care and geriatric support too. There's some really fabulous BCBAs working in that area, but it's different. And working with adults requires a different skill set and set of knowledge that you don't necessarily develop just working or going to grad school. But I digress. So I started working with adults. I started learning about all the challenges that adults face with funding and support and quality care and training for their caregivers. And it just really kind of became a passion of mine to give them an equal level of care and support that the pediatric population gets. During that time, I then became pregnant with my son. And when he was born, our nursing journey did not go well to start with. Initially, the thought was it was just a tongue tie, and that if we took care of the tongue tie, that it would resolve itself. It did not. So then I found a specialist, a speech therapist who specializes in feeding, and I took my son there. And during the assessment, I'm sorry, I'm going to get a little choked up. During the assessment with her, she's like, you see how he's turning red and his eyes are watering when he's nursing? I was like, yeah, I see that. And she's like, that's signs that he's aspirating. And it was just like the whole world shattered because, like, what? So she's like, I'm also seeing signs that maybe there's some neuromotor stuff going on. She's like, you need to go see a neurologist. So I'm like, okay, well, my pediatrician, she's great. I'm sure they'll give us a referral, no problem. Make the appointment. And the nurse practitioner that we saw, she's looking at him and she's like, well, I don't see anything that is concerning. He looks fine to me. I'm like, okay, well, the speech therapist, she said that she sees signs that he's got something neuromuscular or neuromotor going on. She's seeing like maybe some weakness and or something else going on, and suggested that we see a neurologist. So like, even though you think he's fine, I'd like a referral. And she's like, well, neurology takes time to get into. And my thought, being in this field, is like, I know it does. Hence why, even at 4 months, I'm like, I would like this referral, right? Like so she goes back and forth with me a couple of times, and her response kept being like, well, we should just wait and see. He might just grow out of this. It could be nothing. And I'm not one for confrontation. I usually don't push when somebody tells me that we should just wait and see. Like when it comes to me, I'm like, okay. But this is my son. He's 4 months old, and I was just told by somebody who truly took time to listen and hear that she thinks there's something going on. And so now I'm like, no, I'm not taking no for an answer. Give me the referral, or I will go find somebody else who will. And that statement kind of was like, oh. So she's like, fine, I'll give you the referral, but just know that by the time you get in, it could be nothing, and he could have grown out of it by that point. I was like, I hear you, but what if he doesn't? What if he doesn't? Then we will have wasted 6 months because we wanted to wait and see, when that 6 months I could have been on the wait list to see the neurologist. So we finally got the neurology referral. And in that same appointment, the pediatrician's nurse practitioner also told me, no, I'm not going to send in requests for a swallow study. We don't do that. Why don't you do that? She's like, well, because we can't interpret those results. So we would have to find somebody to do that for you. I know now they don't even need to interpret those results, because after 2 swallow studies at 2 different pediatric hospitals here in DFW, the speech pathologists that do the swallow studies interpret the results for you and tell you what to do before you ever leave the hospital radiology center. So I was getting excuses and reasons why. And all of that now, fast forward, leads me to decide when my son is about 8 months that I'm going to start my own ABA practice focused on teens, preteens, teens, and adults, and be a resource for families, that when somebody says, no, we can't do that they have somebody to turn to, like the feeding therapist that my son sees, who's like, actually, we can, and here's how we're going to do it. So that's kind of the long and short of it. But it's just doctors, therapists, pediatricians, their job is to listen to parents. And if a parent asks for an assessment and there's no harm that will come to the child for doing the assessment should be done, because then we can definitively say, yes, there's a concern, or no, there's not.
Well, first, Corinne, thank you so much for sharing your story. I know that takes a lot, but it's so powerful. And I know there's so many other parents and families that experience this, and we don't have a place to share those stories. And I'm just grateful that you have. And your point about needing to listen, as an educator and having been a college professor teaching future teachers, I was constantly saying we need to stop talking. We need to sit down and give parents that time to share their story, and for us to understand what that story has looked like and how we can help that story continue in a positive manner. And, as you've pointed out, people saying, no, we don't do this, or no, we don't need to. I want to encourage parents to keep their voice,
Mhm.
continue to be that advocate for your child. It's so important. So thank you for touching on those points. Um, so you talked about, parents worrying about being dismissed and that we need to continue to speak up. So when we talk about ABA, I know that there is a lack of understanding of it amongst parents. So can you talk a little bit about that and how you can help families understand what behavioral supports look like for adults and teenagers?
Absolutely. So with applied behavior analysis, or ABA, we are focusing in on areas where a child or young adult or even older is struggling to either become more independent in or understand the nuances of social situations or communication. There's a kind of two sides of ABA. A good behavior analyst is going to look at what behaviors are impeding or preventing the individual child, young adult from being successful in their day-to-day lives, their family life, their social life, whatever areas that they're struggling in. And they're going to try to develop a plan to help decrease or get rid of those behaviors or the barriers that are preventing them from being successful. A good behavior analyst isn't going to stop there, though, because if we just focus on getting rid of behavior and we don't give them the skills they need to be successful in those situations, then we're either going to create a situation where the child or young adult is going to try to find a replacement for the behaviors we got rid of, or they're going to end up having a behavior that just shifts, morphs. So, maybe they were throwing tantrums because they don't want to do the dishes, right? Well, if we don't figure out what it is about the dishes that is so difficult for them, is it getting started? Does it feel really overwhelming? Is it sound-based? Like maybe the clank of the silverware. I mean, that one gets me. I don't like silverware clanking against each other. But, what is it about the dishes that's creating problems, and how can we fix it, or get rid of the components that are making it really difficult? If we just focus on the behavior side of things and we say, no, you have to do it, and I'm going to either force you to do it or give you some kind of external motivation to do it, then we're running the risk of creating autistic burnout. We're running the risk of them shifting that behavior into more severe behaviors. There's a lot of things there. So a good behavior analyst is going to create a plan to decrease behavior, but they're also going to create a plan to address the environmental situations and components that are creating barriers. And then they're also going to look at How do we help the individual or the child communicate to their parents, hey, this is actually why I don't want to do the dishes. This is what's going on. This is why it's hard for me. And focus on that communication side of things too, because especially for um, our our kids that we work with that are on the autism spectrum, there's so much going on internally for them that they aren't always able to communicate to us, that if we fail to really keep that in mind and try to figure that out, um, we're just really doing a disservice to them and their families.
Absolutely. I was the director of a private school for adolescents with autism several years ago. And we had a ninth grader. So he was, 14, 15 years old. Rather big kid for his age, tall, and loved art class. And all of a sudden, he started running out of art class
Oh.
screaming and would run out the school buildings. And he did this 2, maybe 3 days in a row, and we couldn't figure out why. And we were finally able to have him express that the class had moved into a pottery lesson for a few weeks. He didn't like the touch of the clay. It felt like knives were being driven into his fingers. And once we figured that out, then we knew that clay was not a good medium for him to work with in art class. But it's those kinds of things. I've had many high school students over the years lash out, elope, and trying to find a way to find out why instead of reprimanding them for poor behavior. Absolutely. So I do understand that. What opportunities does ABA Services provide for adolescents and adults who want to create independence, strengthen their social skills, and improve the quality of their lives?
There's a lot of opportunity. Unfortunately, for a variety of reasons, the bulk of ABA companies are aging kids out somewhere between the ages of 8 to 12, and it's kind of a range, so some might age them out even earlier and a little later. But there is absolutely no age in which ABA cannot work for. It doesn't matter if you are 18 months or 99 years old. ABA can be effective if you're working with a skilled provider who is knowledgeable about the period of life that the child or young adult or even older is in. As far as like opportunities go, I mean, the sky's the limit. If they're having issues navigating the grocery store and they need to figure out how to interact with a grocery store worker, employee who, can point them in the right direction to find the specific brand of noodles that they like or something like that, right? We can help them. We can teach them what to say, how to say it, who to look for, what signs are that somebody is busy or not busy, how to interrupt, all of those kinds of skills. And that's just the grocery store. Like, it can be job skills, it can be navigating the community. It can be even, say that your child got an autism diagnosis at 17, because that happens sometimes. And you're like, oh gosh, like, we've got an autism diagnosis now. We can get insurance to cover ABA. But if they're 17, where do we start? Well, we start still at the same place. Is there any behaviors that are impacting them that we need to try and fix? Are there skills that we need to help them learn how to do? Um, Activities of daily living, so chores, hygiene, all of these things, the different autism spectrum disorder, ADHD, intellectual disability. I mean, all of these different diagnoses, they do impact across the spectrum of life. Sometimes different insurance providers get a little finicky about letting us work on things, but what a behavior analyst can also do is help the parents learn how to then teach their child the skills. So if you're a parent and your child is in ABA and all you're being given at your parent meetings is a skill report and saying, yep, they're doing great, that's not good parent training, and you should absolutely ask for more. Your behavior analyst may not have been taught how to give good parent training and parent support, but a parent session that is meaningful will allow the parent to be heard, because that is absolutely important. But it also should involve, once the parent has been able to give them an update and be heard, it should be a collaborative back and forth conversation about what's going on, things that we need to address or support, how the BCBA can support, how the parent can support, how the RBT, the behavior technician, if they're working with one, can support, and even collaboration amongst providers, because anybody that tells you ABA can work on it all, that's not true. We all have different skill sets and knowledge, the different therapies: physical therapy, occupational therapy, speech therapy, feeding therapy, mental health support. Everybody has their own specialties and skill sets, and it takes that team approach. So parent support can also involve that collaborative benefit across a team.
Wonderful. Thank you. That reminds me that individualized transition plan that every adolescent should have.
Yes, yeah.
Absolutely. And federal law tells us that has to be in place by their 16th birthday. But I know some states in the country still offer that individualized transition plan at the age of 14. So parents need to check out when that transition plan needs to be in place based on their state. But what you've just talked about are goals and objectives that should be placed in that plan. And parents can be part of that conversation, not only in creating, of course, the goals and objectives, but how that home to school communication occurs. So there's consistency in how an individual is learning a task.
Yeah, in that transition plan, I've seen some really great meetings and I've seen some really not great ones. So parents, it's another opportunity for us just to step up and say, hey, wait a minute, this doesn't feel like this is actually helpful. We need more. And if the school district says, well, this is all we got, no. There's absolutely more that can be offered.
Agreed. I can speak from the view of research. There are 4 different kinds of individualized plans for special education in the public sector. And it is the individualized transition plan that is the least implemented and the goals the least achieved during a child's high school years. So it's fascinating to me why those plans aren't stronger. When we talk about services beyond high school, for some until age 21, they'll get those services. But for the most part, parents are then having the burden of continuing those services. And when private insurance doesn't kick in, many parents don't know about Medicaid and other funding sources. Can you talk to us a little bit about that?
Yeah, so every state has their own Medicaid waivers. Each state gets funding from the federal government to fund these waivers, and then it's up to the state to determine what that looks like in an application. So like for me here in Texas, we have several different Medicaid waiver programs. And if you have an intellectual disability or an autism diagnosis, you can qualify for the Medicaid waiver programs. It's important that parents get on the wait list, the interest list, early here in Texas. There's currently a projected 20-year wait list if you don't qualify for a diversion slot. A diversion slot is simply a few spots that the state reserves each year for individuals that are at risk of being institutionalized due to behavior or health concerns. And so families, if you're in that kind of a spot, there's your local intellectual and developmental disability association, or agency, I think is what it is, or your LIDA. So each county is going to have one. The service coordinators there can help you apply for these diversion slots. But if your child is okay, maybe they need some support, but they're not at risk for the institutionalization for behavior or health, even if they're 2 and you're like, well, maybe they won't need any help by the time they're an adult, still get them on the list, because we just don't know what the future holds. And you can always decline the service when your spot comes up and tell them we're okay, we don't need it. But if you wait till 18, 19, 20 to get your child on the interest list, well, then now we're looking at 40 for when they would come up on the list. And that's a whole lot of time in between where school ends and the waiver would pick up if you wait until the end of school to put them on the interest list. So like for my son, we just didn't know what the future would hold. So, he's 16 months now, and I put him on the waiver interest list at 4 months because we didn't have a diagnosis technically. There was like talk, maybe it's like cerebral palsy, but we just don't know. And I'm sitting here thinking to myself, okay, do I waste a year or more waiting to see if he's going to be able to have a relatively normal or completely normal life and skills and development? Or do I go ahead and put him on the list now, and I can always take him off if in 6 months, 12 months, a year, 2 years down the road, everything resolves. So I went ahead and put him on the list, just like, okay, like let's not waste any time. But I know that because I work with primarily Medicaid waiver programs. If I didn't know that, I wouldn't know. So I try to make sure any BCBA, no matter what age the families are that they're working with, they know about these waiver programs. Any family, even if I don't end up working with them, I'm like, hey, do you know about the Medicaid waiver programs? Because there is such a cliff of services, is what I've heard it described as by some researchers in the field of behavior analysis, where we have like all these services, right? I have like my hand up high for people that can't see video, and my hand up high. And then as soon as like 18 or 22 hits, it just drops off like a cliff. And the Medicaid waivers can pick up some of that and make the drop less dramatic, but you're not always going to qualify or come to the top of the list at the same time that school ends, especially if maybe your child was diagnosed a little bit later on in life. So in the interim, right, like private insurance doesn't necessarily cut off at 18, because that's another belief that has been kind of spread around, is that at 18, ABA or other therapies, like we're done. We can't do it anymore because insurance won't cover it. And that's also not true. Usually places end at 18 or 22, because they just don't have the skill set and the training and the knowledge to work with individuals into adulthood, because there is such, like I said earlier, there is such a difference between working with somebody who is 18, 19, 20 years old, is a legal adult without a guardian, and can absolutely turn around and say, you know what, I don't want to work with you anymore. I don't like what you're telling me. Versus working with a 10-year-old who can be like, you're fired. But really, parents are the ultimate, determining factor there. So we have to be aware of the nuances in working with someone who may or may not like what you're telling them as far as behavioral interventions. And if the individual we're working with is like, I don't like that, I'm not going to do that, then even if it is the best way to approach it, if you can't convince them of that, you're going to have to go back to the drawing board and find a different intervention. So I kind of got off track there, I think. But yeah, there's still lots of opportunity and resources for funding. But the Medicaid waivers in each state are going to be a little different. So I'm licensed in Oklahoma and I'm certified in Ohio, and each of those states compared to Texas have different programs and resources. So parents, if you're in a state, that's not Texas, then I would encourage you to look at and just Google Medicaid waiver program and then like whatever state you're in and see what comes up. And usually it's within like the Department of like developmental disabilities, or in Texas, it's the Health and Human Services Committee. They'll have a website through the state to talk about these programs. And somewhere on the website usually is a spot to say, like, I need more information, or I'd like to sign up, or somewhere in there you can find a place to contact someone to start getting processed through. And every state is going to have different wait lists too. So like I know what the Texas wait list is because that's my local state. I could not tell you, like what the other states are. Some states there's no wait list, and some states there's a wait list, but not quite as long as Texas is. So, I would encourage, no matter where you live, that if your child has a diagnosed intellectual disability or autism diagnosis or a genetic condition that could result in something like that, or maybe their genetic condition could or could not have it. It's really like there's no harm in putting your child on the list and then pulling them off later.
Thank you for sharing that, Corrinne. We're going to need to wrap up our time together. Is there anything else you'd like to share with our listeners today?
I just think the biggest thing is it's hard and scary when you don't have answers. But if somebody's not listening to you, whether it's a BCBA or another therapist or your education team, a doctor, whoever, it's okay to go, even if you've been with that provider for a long time. Because like the pediatrician we had been with him for 2.5, 3 years by the time I left that practice to go find a different pediatrician. And, it's been one of the best decisions I've made for both of my kids to find a different pediatrician. And even, here's the thing, even if somebody in the community recommended that provider to you, it still may not be the best fit for your family. And that's okay too. I know I'm not always the best fit for every family that I come across, and I've referred out because of that. And a good and skilled provider, pediatrician, doctor, therapist should be able to recognize and have that honest conversation with families that, I would love, love, love to help you, but this is outside of my skill set. So yeah, a couple of things. Don't be afraid to get a second opinion. If you're not a confrontational person, it's okay to just say thank you and then go somewhere else. And that there really should be a collaborative conversation between parents and whoever the provider is, because we're ultimately there to help the families, not to prove our ego and that we're right.
Corrinne, thank you so much. And thank you for joining us today, for sharing both your professional expertise, and your personal journey with honesty and compassion. Those stories are so important and we need to hear them. Your story reminds me that parents know their children better than anyone else. And while that path to answers is not always straightforward, trusting your instincts and continuing to advocate can make a profound difference in your child's life. Today's conversation also challenges an important misconception by reminding us that support does not end when childhood ends. Adolescents and adults deserve opportunities to continue learning, growing, building relationships, and developing greater independence through their lives. At Empowering Parents Network, we believe informed parents become confident advocates. The more families understand the resources available to them, the better equipped they are to help their children reach their full potential at every stage of life. Thank you for joining us for another episode of Voices of Empowered Parents. If today's conversation encouraged you, please share it with another parent, caregiver, educator, or professional who may benefit from learning that hope, advocacy, and meaningful support continue well beyond childhood. Until next time, this is Dr. Julie M. Lane. Keep asking questions, keep advocating, and keep empowering the children and families in your community.